I'm Dr. Maura Lipp. I am a pulmonary critical care physician as well as a hospice and palliative medicine physician. About a week or so before I got diagnosed, I had started becoming short of breath as I was walking down the halls at the hospital. And I had also at the same time had some fullness in my abdomen, which I didn't immediately put the two and two together. I went back to work the next day and they called me while I was at work and said, hey, we can do your CAT scan today if you'd like. And it wasn't even 20 minutes later that I received a call from the radiologist directly. And he said, I don't even know how to tell you this, but you have evidence of widely metastatic disease. Just out of nowhere. I just sat there for a minute and said, how am I going to go home and tell my husband this? I had been admitted to the hospital because my breathing had gotten so much worse. That was right before Thanksgiving. So I was admitted and they started chemo right away. One of the very first things I did when I was still in the hospital was say, I want palliative care, call Compassus. Because I knew I had metastatic cancer and I was going to need them from the very beginning. And a lot of people think if I go to palliative, well, that means I can't get my chemo or I can't do, I'm not going to get treated any other way. And I'm not ready to let go of those things. So I can't go into palliative care. And that is such a common misconception. My palliative care NP facilitated the whole thing, explained things beautifully to my husband. There was a period of time where I was really concerned about him, and an RNP spoke to him, normalized the process, right? Told him what to expect, what things were likely to look like, took away a lot of anxiety and stress. And I think now of how much harder that would have been if she hadn't been there. We really needed a facilitator. Even me, a physician, a critical care physician, and a palliative medicine physician. You'd think it would be easy, but it's not when it's you. And so having that help was just vital.